Hi, I'm Dr. Nicole Vane, the owner at Moonlight Beach Dental of General and Holistic Dentistry. And I want to talk about one of my new favorite subjects, which is PRF and regenerative therapy. So PRF is platelet-rich fibrin, which is essentially the stem cells from your own body that we use to help your body heal. There's a lot of super cool research going on right now at King's College in England, where they're actually finding ways to use stem cells from your third molars to regrow your tooth. I don't know how many decades it is away from being used in primary practice, but instead of doing a filling, we'd actually use these stem cells to refill the hole in your tooth. So while right now we only have animal studies on that, we are using some of that same science with PRF to heal infected areas in your mouth or to heal infected and inflamed nerve canals. So essentially what it is, I always use it with my surgeries instead of using a bone graft material that might be bovine, which is cow, or sterilized cadaver bone, or a synthetic product. What we like to use, because we're holistic, is something from you. So obviously you're not going to react to it if it came from your own body. So we send you out to a local lab, which is very close, right before you have a procedure done that's surgical. And what they'll do is they'll draw your blood, and it takes about 20 minutes in the centrifuge, where all of a sudden you'll get this really nice gummy bear looking clot that floats to the top of the vial. And then the rest of your platelets are separated down to the bottom of the vial. So we pull out this little plug, and we have a series of instruments that'll compress it into a special membrane of all the best healing factors that you have in your blood and your body, and inflammatory mediators will be packed into the socket if we took out a tooth. Or now we're learning a lot of techniques where we can use it on a tooth or a nerve that might be dying. So before it's actually a dead necrotic tooth, if we capture it at the right time, we can actually go in, remove the decay, and pack PRF in over the most inflamed area of the nerve, and the tooth can actually heal itself instead of it needing a root canal. So I'm doing an extra surgical training course in it even next weekend, another all-day course. I absolutely love it. I'm seeing great results for my patients. This is something that if you're having surgery done elsewhere, you should certainly ask your oral surgeon or your general dentist if it's something that they offer in the office to provide as a socket preservation technique for an extracted tooth. And really just do your research and see what's right for you. But feel free to ask me anytime if you're ever in the office about PRF, or if you're here for a surgical procedure, we'll get you all set up with the lab to have your blood drawn and make sure that you have a very smooth procedure.